Welcome to the webinar on Poverty, Hunger and Disability, the Missing Link. This is the fourth in the series of webinars, which we've been doing from the last years. And we are focusing, today we are focusing on towards living independently in community with dignity for all persons with disabilities. I request Mr. Rajaram to give his presentation. And before that, a small intro note about Mr. Rajaram. Dr. Rajaram Subbain, a psychiatric social work professional, is a mental health practitioner for 5 decades in different capacities, starting from national, then regional, to being psychosocial advisor in international organizations. His higher studies of MPhil and psychiatric social work, PhD, were from the National Institute of Mental Health and Neurosciences, Bangalore in India. Dr. Rajaram has 2 decades of clinical and community mental health exposure, teaching and training at NIMHANS. For 13 years, he worked in Sri Lanka, Uganda, Nepal, Bangladesh, and Afghanistan with families, children, and communities traumatized by war, armed violence, and abuse. He personally interacted with thousands of affected children and families, building resilience in children and communities, and developing community-based curriculum in social work on child protection, both in Sri Lanka and Afghanistan. His niche is improving community mental health, promoting community-based psychosocial care and interventions for persons with mental illness, and strengthening therapeutic skills in social work or mental health professionals, community workers, and lay counselors working with vulnerable people. Dr. Rajaram is an international trainer cum practitioner on community mental health and psychosocial well-being, and currently the executive board of Basic Needs India, Bangalore. That is the resource building organization in community mental health and development. Over to you, Mr. Rajaram.
And Venky shared with us already the statistics of people in going through mental illness. So I will skip that. Just to say that, Suja, can we go to the third slide? Next. Yeah. Only to say that 1 in 7, at least in Indian population, they go through some mental disorders, disturbances. Okay, that you can imagine what huge number of people in need of help and intervention. Next. And yeah, mental illness is quite a complicated one to deal with, because the treatment may be easy to understand, but the myths and misconceptions that people in general they have about mental illness, that is the main block in reaching out persons with mental illness and also treating them and providing all kind of other interventions. Okay, every community has different beliefs, misbeliefs, and anything or you can imagine is interpreted as sin or possessions, or could be karma, that is previous birth, whatever we have done, we carry it. And so people fear, it's a kind of a taboo. People fear persons with mental illness, and not many think about treatment or other interventions. Immediately they feel they need tying up, and they should not. So people hesitate to come out and say, yes, there is a member with mental illness in my family. So ultimately what happens is they are hidden, they are locked up, and the illness becomes chronic. And another main drawback in mental illness is that if you don't treat the person with mental illness properly, appropriately, the longer the symptoms remain, our life skills start deteriorating. So people with mental illness, you will see they have, this is what, even after treatment, unless we help them to improve the life skills, they remain affected. That's why it comes under psychosocial disability. Okay, so what we need to do is, they also say that the golden hour is the first 2 years. If we don't treat them during those 2 years, and there's likely the chronicity sets in, and it becomes extremely difficult to rehabilitate and to reintegrate them back into community. Next slide. Yeah. Yeah, we'll go to the next one. So when we talk about treatment, since the families have or improper understanding or misunderstanding of illness, and they don't want to say that there are people suffering through mental illness. Many, they do not know it's mental illness. So they believe quite a few, the local traditional healers. So they don't come to the hospital for treatment because the hospital has effective medical treatment, but they don't want to, they avoid it and then go to various faith healers and traditional healers. Okay, that's another reason, the delay or refusal to come to hospital treatment. Next. Yeah. And as we said, there are at least some 10 to 12% of people suffering from various kinds of mental illness and disorders. And if you look at what kind of services we have in the country and how many mental health professionals are available, I'm talking about India, the professionals available for such a huge 1.42 billion people, and looking at the people suffering from severe mental illness, it runs to millions. But if you look at the mental health professionals, there are something like 3,000 to 4,000 psychiatrists, similar number of other psychiatric social professionals, psychologists, clinical psychologists, and psychiatric nurse. So if you look at it, the availability of the mental health professionals for such a huge population suffering from mental illness, it's hardly 1% or less than that. Okay, so that's, and added with the myths and misconceptions, 80% of people suffering from mental illness, they don't get adequate treatment, either because of lack of funding from the government, so the facilities are very minimal, and lack of mental health professionals, as I said. And because of all this, many remain untreated, and in this, many remain locked up, chained, and kept inside the house. Okay, and so again, if you wait, and if at all they go to hospital for treatment, then the hospital becomes an institution. And so imagine the family takes the person suffering from mental illness to a hospital nearby and admit him and provide all kind of interventions necessary, what is possible in that hospital. And when he brought back, the community doesn't know what happened in the hospital because they remain in their mysterious beliefs, and they do not know how he becomes improved and how he is back without, meaning minus mental illness. So the myths continue, the misconceptions continue. And looking at all these things, that even institutional care doesn't deal with the stigma and ostracization, and the family members hesitate to take them for treatment. And so when we look at all this, the best is to use or to utilize community stay and help them to get treatment and improve. Okay, so basic needs India, that's what we believe. And we have been working in the field of community mental health for last 22 years. So our motto is not to admit, unless it's desperately necessary, not to admit anybody in the hospital, but retain them in the community and build the services necessary for people to recover and provide the rehabilitation opportunities and get them reintegrated. For this, Though, next please, next slide. Though it sounds simple, but it's very difficult, but we have to work hard integrating whatever the interventions into the community. Okay. Mainly because community has all kinds of the organic support system. It's available. So
You have
it's
2 minutes, Dr. Rajaram.
Oh, then you can skip other next, Suja. And next slide. Yeah. So we build partnership with local organizations, and we build the capacity of the staff members and also community volunteers identified, and then create lots of awareness programs in the community. And then the volunteers identify people with mental illness, provide psychoeducation, visit homes, and so slowly we build all kind of awareness, and also we strengthen the stakeholders, the government and non-government, and the local community stakeholders. When we say awareness and helping them, orient them, and then sensitize them on mental illness and mental health in general, and help people with illness to take treatment, be at home, and the community-based organization do the follow-up, monitor, and as they improve, help the family members to engage them in the household responsibilities, and also improve their life skills and regain the livelihood what they lost, or help them to get into new livelihood. If they are not able to do, then help the family members to improve their lifestyle or their economic background by taking up livelihood. So the entire process takes place inside the community. Because it happens inside the community, the public also understands what is mental illness and how to be supportive with them. And in the course of this project, the entire community is aware of mental health and mental illness, and we feel that that is the best alternative. We need definitely the government system, because district mental health program is the one which helps them to get treated and also provides free medicines. What we do is bring them together, and we also do this. The process itself is advocacy among the community, and we also organize the family support group, so they advocate for the people with mental illness, and they go to the government stakeholders and demand better service. So in the places where you are working, particularly in Orissa, the government has launched the district mental health program in all the districts that you are working, and we work very close with that DMHP, and there's a very good networking, good understanding, and we are able to do this effectively. And when we are able to do it effectively, we wonder why not all of us do it.